So good.
Cool. Here we go. Here, that's my comedic. That was totally planned, just to lighten the load a little bit. No, that was me learning technology. Here we go. We are recording now. We're live on Facebook and scene. I am Dr. Jason Bradley. This is the Hope Dealers podcast, Wednesday, December 23rd, episode number 3. I am privileged and honored and thrilled to be here. I got to read this list because my guest today has so many accolades that I have to read this list. Yoga master, yoga therapist, Pilates instructor, breast cancer exercise specialist, kinesiologist, master's degree physiologist, noted wellness expert, and so much more. Marcie Evans. Marcie, welcome to the show and thank you for being here.
Thank you so much, Dr. Bradley. Nice to be here.
Yeah, we go a little ways back. I mean, we're kind of from the same area, and I know we share a lot of the same folk, around the area. We're in Iowa, so I think there's only about 35 people in the whole state. But I think we know all of them. But I know your story, and I think just jumping in, because I gave you that intro, your career, your passion, I've seen it develop over the years. And like I said, I know your story. I don't want to give too much away. I would love for you to just kind of share your story and tell our listeners how you got into doing what you're doing.
Absolutely. So it's been a long road. I'd like to start by just kind of going back to kind of those college years, because that's kind of where I got started and interested in all of this. I graduated from college and I took some jobs that were not desirable right out of college, like most 20 somethings do. And yeah, me too. Raise your hand. So anyway, I graduated and took on several different jobs, and I was working really, really hard to try and get through that time in my life and try to start making money and get into a field. I didn't know what that field was going to be at the time, because I had just finished a degree in biology, kind of an emphasis in kinesiology, physiology. Didn't really know where I was going to go. So took a few, random different jobs here and there. I took a job as a laboratory technician. I worked with virology. So I was doing, pipetting, all kinds of crazy things with viruses. And I was working as a waitress, and I was working as a exercise instructor at the time. I was doing like the hardcore stuff, the tough classes, the cross training and the kickboxing and step aerobics and all of that stuff. So I was basically working 3 jobs at the same time. And, I was just being inundated with stress from all sides. And eventually my body just said, this isn't working. This isn't working for you. And I started to have all kinds of strange, weird symptoms. And they were all autoimmune related. At the time, I didn't know that. My mother had Graves' disease. And I really didn't even ever talk to her about it. Didn't know she had it, because she had had a scar on her throat. And I always wondered what it was from, but she had had her thyroid removed. And so she was on levothyroxine. And I really didn't know anything about it. So when I hit that, that stage where I was very stressed, I went into, Graves' symptoms, started to have Graves' disease symptoms, and started really to become very sick. At one point I was down to 85 pounds. I was, anyone who's had autoimmune disease probably knows the story. It kind of always goes in a similar direction, even though the symptoms are different for everybody. I was extremely sick, heart palpitations, the whole thing. So decided I was going to go see someone. I went to see my general practitioner, and they basically just said, "You're healthy, nothing's wrong with you, go away." So then my husband started to search, and we finally decided, okay, this is really getting bad. I mean, again, 85 pounds, that's not normal for me. So we went to Rochester and went to Mayo Clinic, and I got checked out there, and the doctor basically told me, unless I was willing to do radioactive iodine, he was unwilling to treat me. And I wasn't into that. So I said, okay. see ya. And we parted ways. And then I came back to Des Moines, and my husband looked around for some other doctors. And finally I found a doctor who was willing to talk to me about different treatment options, and decided to go with methimazole, which is a pretty
Mhm.
common treatment nowadays for Graves' disease. At the time, I don't think it was very popular, but now it's definitely become a little more commonplace. And I was in total remission with that, and changing my lifestyle, and practicing yoga and changing my diet and all of those things. I was in remission within a year and a half. And I've been in remission for 20 years now with Graves' disease. You always have it. It's still there, and it could come back, but 20 years is, I'm pretty sure that I'm feeling good, that
You've nailed something down for 20 years of
that part of
remission.
my life is, it's changed. So anyway, come a little bit farther on, motherhood hits, right? And you get pregnant, you have a child, and you're dealing with pregnancy, and you're dealing with breastfeeding, and you're dealing with stress from having a new baby. You're dealing with all the viruses and bacteria and everything that you're inundated with from daycares. So you're getting, you're just getting hit from all sides. You're not sleeping well. You're not sleeping enough. Anybody who has a child knows this. It's rough, right? So then, about 2 years in, she's a toddler, right? Middle of Toddlerville. She's all over the place. She was never a good sleeper. That girl did not sleep until she was 4, right?
Sounds like my
So,
kids. Yeah, I hear you.
just not a good sleeper. So then, she's about 2 years old. I had another autoimmune episode, and this one was completely different than before. This one was Sjogren's
Mm.
disease. So I ended up having, actually, after all was said and done, I ended up having 4 diagnoses. But each time I came back to my practice of yoga, of breath work, of meditation, of, just analyzing my diet and seeing what else I can do to make it better, to make it more conducive to healing, and removing all the toxicities from my environment, and trying to maintain my sleep. All of those things have played a role in where I am today. So I just started to accept a different lifestyle, and really try to lead the lifestyle of example that, that I was trying to get my students to follow, but I wasn't very good at, because I had all these things that were attacking me from all sides. So it's been a long road, and it's been a really good journey and a really good transition. And honestly, I think without having these diseases, I wouldn't be where I am today. I wouldn't be helping people. I wouldn't be able to tell them my story. So I'm really happy to say that these things have brought me to a better place.
I love that, and I know that it's used a lot, but I like when I hear this. I like to say the mess has become the message, right? I mean it, and it really does just. Anyone that has suffered from autoimmunity understands exactly what you're talking about. It just tears your whole body up. It can be progressive over time. And is my audio okay?
Yes,
Oh,
yes.
oh, perfect. There was a little click. So
Yeah, I heard that.
that's sorry about that.
Yeah.
But it can tear your body up over time. They're progressive, and the treatment options are generally fairly limited. I mean, like you mentioned, if you go, a lot of these are I would say endocrine organ based. I mean that's not totally universally true, but or at least focused. And so you go to like the endocrinologist, or your general or your specialist, and they want to cut stuff out, and
Yep.
or medicate you. A lot of those medications are meant to suppress the immune system.
Mhm.
And I think that you're right. Like with the methimazole, it's interesting. I see that not even today. I mean, my specialty, of course, is autoimmunity, and specifically thyroid autoimmunity. So I have a lot of experience with what you're chatting about, and I really don't see patients coming to me even still to this day. A lot of them on methimazole when they have Graves or autoimmune hyperthyroidism.
Mhm.
But it's just very interesting. I also wanted to say that the message become the message. I wanted to say also thank you, and I'm teasing. Please understand, to all of the GPs that say that you're totally healthy and there's nothing to do, because it makes folks like you, like me, and our colleagues really dig in to figure ourselves out. And then
Right.
when we are given that gift, of figuring it out, usually on our own, a lot of the times with a lot of heavy research, we get better. and we go into remission, we're able to share that with people and hopefully improve their lives and help them with that suffering, you know. And I know you well enough to know that, you know, one of your big goals in life is just to help people, you know, I mean, just give
That's right.
and
Absolutely.
contribute back in the ways that we can. I think that's just absolutely fascinating stuff. I had a lot more written down here to ask you about, but I do have a couple of questions. Have
Sure.
you heard? I randomly here. You mentioned
Mhm.
methimazole, and you know, people come to me a lot of times because they want a natural medicine. Have you ever heard of blue flag before being used?
I have not. No.
Yeah,
Enlighten.
I yeah, it's so no, it's just an herb. So it's botanical medicine, and it's
Mhm.
the only botanical medicine that I've seen have the, I don't know if potency is the right word, but the effectiveness of the drug methimazole. You
Mhm.
know, I always like natural medicines if they work. And this is such a general statement, but and I think that we can agree that synthetic medications are tend to be harder to clear out of the body. Natural medicines might be easier to clear out of the body. There's a whole
Yes.
bunch of middle ground there that I could already come up with except many exceptions to that statement. But I would recommend just checking out Blue Flag just for fun. I'm not recommending to switch to it by any means. If you're in remission and something's working, by all means, you know, stick with that. But just for fun, to add to your lexicon and to add to your kind of big understanding, look up blue flag. It's very interesting. It's the only thing I've seen that for autoimmune hyperthyroidism or Graves that works as effectively as the drug. Caveat to that, holy cow, is it expensive when you find, I mean, the dosage on that is almost pricing it out. So it's
Yeah.
probably also why it's not really used in natural medicine, because I think you have to be Jeff Bezos to be able to afford to stay on that. Um,
Right.
you mentioned a word, a couple of words, remission. And
Mhm.
I know in your bio, and I love that you said this. You said, where did that say that? Boy, I can't find. Oh, there's no cure for autoimmune disease. I have it underlined even, and I still couldn't find it. There's no cure for autoimmune disease. Could you?
Right.
And just for our listeners that might be confused about the difference between a cure and remission, would you want to
Right.
walk through that?
Yeah. So I mean, I guess I've just always felt like autoimmune disease was one of those things that once you have it, the antibodies are there and you can change the levels. I mean, obviously we can go in and we can do tests and we can see the levels of the antibodies and, you know, maybe
Mhm.
where they're going or what they're attacking, but there there isn't really a cure for autoimmune disease. And by cure, I mean it's gone forever. It's not coming back,
Right.
right? And by remission, we mean that it's gone for now. It could possibly rear its ugly head again in the future, but it's not necessarily going to. You know, we don't
Right.
know. It's
That, because that word sounds so heavy, like cancer, you know, like
yeah, it does.
I mean, and the interesting thing is, I think, not to poo-poo cancer by any means. My dad, thank God, survived, and I love this word. My dad survived a terminal brain cancer, like with a
Right.
0.000 however many 0.01% chance of survival, and he's here 8 years later, which is just fantastic. In fact, he's sitting in my house, in my living room right now, watching CNN. I'm pretty sure. Um, uh, Keep up to the minute, you know.
Yeah.
And I think that the remission is interesting. And you mentioned a few things, and I'm sure that there's a lot more to this story, but I just wanted to kind of come back with, you know, when we go into remission, like
Mhm.
Marcie said, it means that our antibodies have gone from positive, hey, you have an active autoimmunity, to negative
Right.
on the labs. We see that a lot. And it just kind of depends on the doctor or the clinician or the person that you're speaking with. Sometimes, if their symptoms are just non existent, but the antibodies are positive, some folks will call that remission too. For
Right.
my patients, I call remission when their antibodies are negative. And I should say very clearly that what you and I are talking about is not FDA approved.
Mhm.
What we're talking about is medical heresy. Once
Mhm.
you are diagnosed, it is, like you said, it's forever. There is no cure, and there is only, quote, treatment forever.
Absolutely.
But I do want to talk about the, I don't like the word treatment, but let's talk about this treatment:
Okay.
yoga, breath work, meditation, diet, sleep, stress management, mindfulness. I love it. I love that list. It reminds me a lot of the Epic 5 plan that we developed, and we have our first book coming out in early 2021. It would have been out in 2020, but save for the obvious 2020, everything that happened in 2020, where we have folks focus on hydration, diet, movement, stress management, and sleep patterns, right? And that's the core 5 that we've come up with. And I love that you and I have even chatted about this. And you basically gave me that list of, with everybody that you've talked to and all the experts that you did, this is, along with proper, whether it's natural medicines or medicines, you're in remission. Do you want to give some lip service to that? Tell us about what that means to you.
Can you rephrase the question?
Oh, sure. Yeah. Like, tell us about the yoga and the breath work and the meditation. It reminds me of Baron Baptiste, who I don't really know much of his work, but he's great. He's had some great sound bites, so to speak. And he said, in yoga, we have to work on the hard stuff, and the hard stuff is the head stuff,
Yeah.
and I think that's a beautiful statement, right? So
Yeah.
I'm gonna, and because you mentioned also that 20 years later, babies and stress and bad sleep, and all of a sudden there's a new episode and Sjogren's, but then it's polyautoimmunity, and the first things that you said were, I did yoga, I did breath work, meditation, mindfulness. Tell us about that connection that you found with mindfulness and triggering, if you'll let me use that word, autoimmunity.
Absolutely. Yep. So when we focus on our nervous system has a direct link to the immune system. And the nervous system has 2 different switches, I guess. I like to think of them as switches, but they're 2 different parts to the nervous system, the central nervous system. And then there's a third part that we don't often think of, but I'll kind of go through all 3 of them because this is how yoga works, right? Some people are like, well, how could breathing and meditation help me with autoimmune disease? I don't understand, because a lot of people think diet is enough. And for some people, diet might be enough. But if you add in these other parts, they will help as well. So we have 3 different separate parts to the nervous system. We have the sympathetic nervous system, which is the fight or flight response. We have the parasympathetic nervous system, which is the rest and digest response. And then we have the limbic system, which is kind of like the play dead response, or the shutdown mode, right? So we have all 3 of those. And usually when we have severe, serious trauma, that's when the third one switches on. That one's pretty tough to handle. That one's a little bit more challenging because we have to deal with the trauma before we can go any farther with that one. But the other 2 are pretty easy. To hit. So the sympathetic nervous system and the parasympathetic nervous system, what happens is when we're under stress, our sympathetic nervous system works overtime. And when our sympathetic nervous system works overtime, our immunity goes down, and our ability for our immune system to function properly also goes down. So if we can learn, I call it a life hack, if we can learn this yoga life hack, right, then we can hack into the nervous system. We can tell it, you're not under stress, you're fine, get over it, right? And then we can move into the parasympathetic nervous system, and it can do its job. So the parasympathetic does pretty much all of your bodily functions, except for fight or flight. So it helps us digest our food, right? So if we practice parasympathetic nervous response with meditation and breath work, or gentle yoga, which includes meditation and breath work, then we can actually rein in that nervous system, right? And then we can digest our food, or we can have a good night's sleep, because now our system is ready for sleep. It's prepared for sleep. If we're in the sympathetic nervous response, we're not going to be able to sleep, or we're going to sleep and then we're going to wake up, and then we're going to sleep and wake up, which a lot of people have those issues. And then the body can't heal itself because it's not sleeping. So then we have an inability to repair that cellular damage that we're, causing every day when we're awake and doing things. So you have to be able to repair the body, and that sleep repairs the body, right? And eating properly repairs the body. So we have all these things that kind of play a role in either promoting good, healthy cells or creating havoc within ourselves.
I always say that, oh, sorry, go ahead.
Oh, and yoga can help with that. It can also help decrease inflammation overall, which we know inflammation is one of the major things we're looking at with autoimmune disease.
Absolutely. I did a whole hour long training with my coaches yesterday, just on just on specifically inflammation, and more specifically just on the role of cholesterol and inflammation. I don't know how many hours it's going to take to just talk through inflammation, but I love so much that you said here. And I always think, and I think that you said this, but I always think of the nervous system, it's an electrical system, and I think that sometimes people forget that we are energetic beings, and part of that energy is actual real electricity. Some people that have had traumatic injuries have felt that zing, sometimes with people with sciatica, or you feel that tingling, it feels like a little electric tingling. It is an electric tingling. That's exactly what we're feeling, and our bodies create these things called action potentials. I know that you know this, but action potentials that are just energy, electricity being transferred through all these conduits, these wiring, the nervous system, which is really super interesting. And I always think of it as kind of like light switches, right? They can be on or off, right? And we have those three systems: the sympathetic and the parasympathetic and the limbic. And
Mhm.
like you said, sometimes due to traumas, whether that be physical trauma or chemical trauma or emotional trauma, that sympathetic system, that fight or flight system, can be turned on, and it just stays on until somebody, just like a light switch, right? I mean, one of
Mhm.
two things is going to happen: somebody's going to come and purposely turn it off, or that system's going to burn out, right? And I think that we see that burnout with, in stages here. So we had a couple of visitors walk through the studio, so yeah, fantastic. So I love that, and I love that you were basically talking about using something like gentle yoga, breathing, and meditation, which, like you said, go hand in hand, as a reset to the system, which I think is very, very important. Um, I wanted to, and then as we reset that, so purposely pressing that sympathetic system off and turning that parasympathetic on, and then calming that limbic system, with purposeful breathwork, meditation, intention, etc. We do see the body resetting, and we see things like the immune system resetting, and we
Yeah.
do see, again, autoimmunity moving into what you and I are referring to as remission. I use the same word. I haven't heard a lot of people use that word with autoimmunity, so I just love that that came up organically from you. I love that. I Before I jump into the next part, I want to hear all about yoga therapy, but just about plain old yoga. I think you'll appreciate this. So my mom and dad are staying here with us for a little bit here up in the Iowa City area. My dad's recovering from a knee surgery. He's doing quite well. He's only 5 weeks out of surgery, and honestly, he's with a walker right now. But I mean, he's like gets up on that walker, and it's like chasing him. I mean, I'm pretty impressed with him. And my mom, she's 86. I said she was almost 88 the other day on another show, and she said, "I heard you say that," and I'm not almost 88. She goes, "I'm 86," and I said, "Oh, so you're almost 87?" She goes, "I'm 86," and I was like, "Okay." So she did yoga, plain old, mat yoga, for the first time ever in her life last week. And we got her doing it 3 times. And I was so proud of her. I will tell you that she owned child's pose. I told her to go there if she didn't know where else to go or what to do. And so, I would look over and she was, and I was so proud of her. I mean, what a cool thing. Now, when you and I were introducing, or getting reintroduced to each other, I said, that long list of, yoga master, this and that. And you said, I want to talk about yoga therapy. And you know what? I do too, because I would love to hear about the difference between, I don't even want to say a plain old yoga master, because I mean, that's its own accomplishment all by
Mhm.
itself. But what is the difference between a yoga instructor, yoga master, yoga therapist, yoga therapy? Like, tell us about these words, because they start to sound a lot the same, to
Yes.
the lay population.
Yes. So there is a defined designated difference according to IAYT. So that's the International Association of Yoga Therapists, which I had worked on for about 15 years, trying
Wow.
to attain that certification level. And then a few years ago, I went ahead and applied. And basically, the difference between a yoga teacher and a yoga therapist is that typically yoga teachers deal with groups, and they deal with larger groups, and they don't
Mm,
deal with specific medical issues. Typically, they can't claim that they heal. They can't claim that they, are any specific type of yoga teacher, like they're not working with people
Right.
specifically with disease and that sort of thing, unless they have maybe a special certificate that allows them to do that.
Hmm.
But a yoga therapist is somebody who designs specific plans for the people that they're working with. So if it's a group of people, those people would all have a similar goal in mind. So like say, all of the people in the group might have diabetes, or all of the people in the group might be cancer survivors, or all of the people in the group might be individuals with autoimmune disease. So there's a very specific set of symptoms and a very specific goal in mind for that practice. And you would prescribe a practice. So it's more of a prescriptive type of practice than being a yoga teacher, where you would just be teaching a group of people and they may not have similar issues and symptoms and that sort of thing. So that's the basic difference between a yoga teacher and a yoga therapist. But keep in mind that it doesn't necessarily have to be done one-on-one as a yoga therapist. It just,
Sure.
the group has to have something in common that you're
Right.
working on, like a common goal.
I think that's really interesting, and it reminds me quite a bit of what I. This isn't right, and I'm gonna apologize in advance because sometimes I say words and they're not the words that I mean. But so again, I'll go back to my dad with the knee, and so he's seeing a physical therapist, right? And they're prescribing, this is exactly what I want you to do for knee rehab, right? And I love that the idea of yoga therapy, of yoga being prescribed. I love this. I mean, I'm in love with this right now. Yoga being prescribed, and what I love about it, having doing attempting to do a daily yoga practice. I'll be honest, I could probably use some accountability there, but my wife and I do try to do a daily yoga practice. And having done one long enough, I can tell you that it is very physical. You watch people doing yoga and it's almost like Tai Chi, and it looks like they're just slowly moving. But at the same time, some of those, I don't know how to say the word, but the poses, are they asanas? I'm not sure how to say that, but if I'm
Awesome.
yeah, yeah. So
Awesome.
I was close, and but some of those I'm going to call it poses because I can't say it otherwise. Uh, they're challenging. I mean, they're challenging to the physical self, and
Mhm.
I often find myself during those like really focusing on breath work, right, and really focusing on that meditative, contemplative, intentional aspect of yoga. And sometimes, quite frankly, for me, even though I've been doing it for a while, it's a massive challenge for my body. I was not born with a very flexible or limber body. So, I mean, I have to work at these. When other people are doing triangles, I've got like 15 blocks, trying to just stack together. And the reality is sometimes it's a Zen moment for me because I can't think about, my mind can't be wandering to the past
Right.
or thinking about the future, because if I don't focus on trying to maintain that pose and the breathing and keeping my breathing steady and being in that state, I'm not going to be able to do the pose. I mean, I'm literally that dysfunctional with my body. So I love this idea. So tell me, like, walk me through a case. Like, what kind of person, what type of, is it a patient? Do I say patient or client?
I don't know, honestly. We could theoretically call them patients, but I
Sure,
don't prefer that word. Usually I
sure,
use student or client.
yeah,
Um, so, I think one interesting thing here that I wanted to bring up before I get to your question is that oftentimes some individuals who have autoimmune disease, and I would be a perfect example. Back when I was experiencing Sjogren's, I couldn't move my hands. My hands were so um, they hurt so badly. I couldn't wrap my hands around the steering wheel. They would be stuck in the morning, and I couldn't move my hands. My feet, I couldn't walk on my feet in the morning because they hurt so badly. People who are in that much pain don't want to practice what we
right,
think of as yoga,
right,
right? And I think one of the problems with that is that people have an idea in their mind about what yoga is and what yoga should be, right? So they're thinking, okay, I've got to do these standing poses and I've got to do these balancing poses and I've got to do XYZ to get through my yoga practice. But the thing is, they're not right when they say that or when they're thinking that. The goal is to meet you where you are. right? So if you can't walk today because your feet hurt so badly that you can't walk, you're going to do a restorative practice today. You are not going to do a standing crazy power practice, right?
Hmm.
That's not your thing today. And restorative yoga is completely passive. There is no action in restorative yoga other than setting up the props. So if you can move a pillow around and put a blanket over yourself, then you're good to go, right? And then you focus on your breathing, and then you're fine. And then you're actually practicing yoga, and you're practicing the principles of yoga that are going to rein in that parasympathetic nervous system and get it to work, right? So I think that's one thing I
That's
wanted to throw out there. Even if you're
yeah,
hurting, no matter how badly you're hurting, everyone can practice yoga. It is a practice that everyone can do. And don't think that it's got to be one thing, because it can be
right.
something entirely different.
Well, it's like my mom, again, she's 86 to be very highly specific, not almost 87. I told her it was her first time, first time doing it. And, I had on, it was, we were working from a DVD to be honest. It was like beginner's yoga, 101. And, it's still challenging. And I just told her, I said, hey, do what you can do, listen to your body. If something hurts, your body's talking to you, don't do that. And we tried out a couple poses. Like I said, child's pose worked well for her. I said, if you don't know what else to do, you can sit or do child's pose. And so even just sitting and breathing, and she really enjoyed it. I think for her, it's a time to like sit and breathe. I mean, who takes the time to do that anymore, right? I mean, and that's another aspect of it. So yeah, I'm going to come back to my question.
For sure.
I use the word client, and I don't like the word patient, because patient from Latin means one who suffers. And I don't like that idea of just calling someone a sufferer. You're a patient. You're just one who suffers. I mean, that sounds horrible.
Well, and it
Client,
doesn't seem that autonomous either. That's,
it doesn't, right?
like they
The
can't help themselves. Yes, they can. Yes,
right,
they can.
which client, comes from the Latin. I don't know if I'm pronouncing this right, but cluere, which
Hmm.
means one who hears. And I like that idea. I mean, I it's that interaction of the master or the teacher. Doctor comes from the Latin docere, one who teaches, right? But the master or the teacher, and imparting wisdom onto the receiver, basically, a transmitter and a receiver, and then there's a whole relationship there, right? So I don't know. We use client, but that's just us. I want to go back to the question. So
Sure.
the question is, in an ideal scene, someone gets a hold of Marcie Evans and says, "Hey, can you help me?" And you're like, "Absolutely, this is 100% slam dunk, grand slam victory for
Mhm.
everybody." Tell us about that person that's getting a hold of you.
Right. So, I guess, I mean, it really depends on what their issues are. So
Sure,
I feel like I could work with pretty much anyone. It just depends on where we want to go, right?
sure,
So when that person would come to me, and like I said, it could be anyone. We could do chair yoga. We could do
yeah,
restorative yoga, which is completely passive. We could do just breath work and meditation. I work with the person in front of me. So whatever their needs are and whatever their goals are, that's what we're going to do. So yeah, that, I guess it's a hard question to answer, really.
I
But
it's like when people ask me, about functional medicine. I mean, I'm hyper focused on autoimmunity.
yeah,
But at the same time, people say, well, is there something functional medicine can't help? And I'm like, I don't know. It's restoring the function and physiology to the body. I can't imagine that would hurt anyone. I mean, it's from an internal chemist. I really feel like our lives and jobs are very, very much like this. And I want to connect professionally a little bit more as well.
yeah.
But I would ask this, because I would agree with you. Is there, I think it probably goes for everybody, but I'll ask a highly specific question. Is there any diagnosis that's off limits?
Oh, I would say I would try. I would definitely try
Sure,
to work with everyone. And if we found out that there was a better fit for that person somewhere else,
sure,
then I would definitely send them the right direction. I mean,
sure.
I think at this point I have enough experience triaging people, that if somebody walks in my door and I know I shouldn't be working with them, or I cannot work with that
Sure.
specific person, then I would let them go. I would
Right.
send them someplace else. So yeah,
Right.
I mean, it happens, but it's not very frequent because again,
Right.
I think yoga can be practiced by anyone.
Right.
And
I
we
agree.
also have other, I have other forms of fitness and exercise that I teach people as well. So if yoga wasn't the right thing, maybe I have somebody in front of me who's extremely hyper flexible. Maybe they have EDS, right? Ehlers-Danlos. And I'm looking at them and I'm going, you know what? Yoga is not your thing, honey.
Right.
It's not the right thing for you. And they're looking at me going, but I want to practice yoga. And I'd be like, let's do this. Let's teach you a breathing practice. Let's teach you a meditative practice, but let's focus on the strength part
Yeah.
of the
Yeah.
postures. Let's focus on getting your bones and muscles to be strong. And once they're stronger, then they're going to hold better. They're going to hold those joints in place so that we're not overly doing that hyperflexibility, which could put you in a really serious situation, right?
Right. No, I think
So
that's
yeah,
completely correct. Yes.
even with people who are hyperflexible, we can find something, we can
Yeah.
find somewhere to go going to be helpful to them. So yeah, I mean, it's just all about the person in front of you. I can't say that enough. The person comes in, you look at them and you say, I love your goals. I love your needs, but here's what I think you need.
Right. No, I hear you. It's like when people come to us and, a big part of what we do is, diet restructuring, right? I mean, we do
Mhm.
a lot more than that, but, we will tailor a diet based on their, genetic, metabolic, and, sensitivity needs, if I'm saying that correctly.
Mhm.
And when somebody says, well, I'm willing to take pills, but I'm not changing my diet, we automatically know that it's a bad fit.
Not a
And
fit.
so,
Right.
yeah, it's just because I don't want to waste their time, resources, energy, money. I mean, all of that stuff. And I certainly don't want them to say, well, I tried him out and it didn't work out. And I'm like, well, you, you just wanted some pills. So I always say, if you're looking for a Pez dispenser, I'm not that guy. I mean, we'll prescribe, some supplements, some glandular medications, bioidentical hormone. I mean, there's things that we do from our end.
Mhm.
But if people are just looking for, a quick fix, pop a pill a day and high five and walk away, I'm not that doctor, for sure. I thought you'd appreciate this. And then, I just noticed that we went longer than we said we were going to. So, we'll have some parting thoughts here in a minute, but I think you'll appreciate this. My older daughter, she's 20, she's in college, and she had some friends over from college, the other day. And I think there were 8 of them that were here at this time. And no joke, Marcie, 5 of them, of the 8, had EDS. And I
Whoa.
I know. And I said to my daughter, I said, "You collect these people because this isn't necessarily the most, I mean, that's a huge percentage. This is not like
Yeah.
60% of the population walking around with EDS. So yeah. And
No.
so I didn't believe it. And I thought they were just messing with me. But no, I would say to these people, can you touch your toes? And they're like, or not only that, but I could put my hands on. One girl was like, I can put my head down, and I'm like, okay, don't do it anymore. You're freaking me out at this point. We don't need to have a show of like how flexible everybody is. But I was impressed with the population density of EDS with my
No.
daughter's college friends. I was really impressed with it. So, like I said, we went longer than we said. Thank you so much for your time. I wanted to
You're
give you. I always like to end with this question. If there's anything that you hope that our listeners are taking home today, from listening to this episode, what one massive piece of wisdom, advice, practical take home, today is Wednesday. Let's start this on Wednesday or Thursday morning. What would that be?
right. So I guess the one thing I want to say to everyone is that no matter where you are in your life, no matter where you are in your diagnosis, in your practice, keep practicing. And practice is never perfect. Practice is just that, it's practice. So if you're feeling like, today's not the day, all you'd have to do is start with some breath work. Just 5 minutes of breath work can make a difference. So if you just start with a little bit of breath work, that's all I ask.
I
Start
love that.
today, start breathing, and then maybe, who knows, tomorrow, maybe you'll breathe for 10 minutes. And maybe the next day you'll breathe for 15. And then you've got 15 minutes is what we recommend as a yoga therapist, I recommend 15 minutes a day of deep breathing practice. That can make a difference in your immunity. It can make a
Absolutely.
difference in disease process. It can make a difference in your medical, where you're going as far as your health. So
Absolutely.
that's my recommendation, is start with deep breathing and go from there. If you've never done yoga before, it doesn't matter. Get online, find a breathing practice to do, and start there.
Absolutely. I love that. And also just for, we should have asked this earlier, how can people find you? Website and or Facebook handle?
Absolutely. So Facebook is Serenity Wellness Therapy. And you can probably, I think you can do a search for that. And then my website is www.serenitywellnesstherapy.com. And my contact information is there. It's Marcie at serenitywellnesstherapy.com.
Awesome. Awesome. And we'll make sure that this is, everywhere we post this and in the comments and in everything, we'll make sure that those are listed. So, hey, I wanted to say thank you so much again. I really mean this. I had a blast. I learned a lot. And I think that we shared a lot of great information with our listeners. And Marcie nailed it, guys. 5 minutes a day. I mean, literally, if 15 minutes is sounding scrambly in your head, 5 minutes of consistent practice daily will change so much, and it will grow. It will grow. Marcie, thank you so much for your time, your energy, your attention, your presence today. I greatly appreciate it. Thank you so much. And I hope to have you back on the show sometime soon.
Thank you.
You bet. Oh, right. And I'm supposed to say my sign off that I keep forgetting. And until next time, stay safe, stay healthy, and stay happy. Catch you guys next time. Take care. Awesome. Perfect.